MNRI is a specialized therapeutic approach that looks at integrating reflexes.
Okay.
And the approach was developed by Dr. Svetlana Moskotova after her work with children who had suffered severe traumas and injuries.
Okay.
And she found that this approach helped kids recover faster and optimize their healing. We believe a reflex is a unit of measure for how healthy your nervous system is.
Okay.
And so what we do is we look at assessing and treating those reflexes with different approaches. So with sensory approaches, movement, coordination exercises, those kinds of things.
Okay.
And we feel like this gives everybody a chance to optimize their neurodevelopment and health.
Okay, that's fantastic. So what are some of the typical goals that you have with MRNI?
Okay, well, our goals globally for everyone, are to strengthen our nervous system, to strengthen the immune system as well, to optimize neurodevelopment, and our ability to cope with stress that we all deal with.
Everybody deals with that every day. That's right.
Right. And then really help just with growth and development.
What does one of those therapy sessions look like, and what's some of the activities and exercise involved?
Okay, well, it depends on the child, but each session involves some structured exercises that work on helping that reflex mature or develop the right way. And in some cases, that pathway never was there, or because of an injury, we have to rebuild or repave that pathway.
You got to reconnect that highway. Right.
Yes.
Okay.
And so it may look like a lot of tactile work to enhance the sensory system so that it can respond to what's going on in the environment.
Right.
Then we're going to do balance work, activities to balance flexion and extension in the body, so that overall we're healthier and able to respond quicker.
How long does this last, or is this a continual thing? It's just out of my own interest.
It can be a continual thing. I mean, there are exercises that I try to do on a regular basis because they help me. But it really depends on the child and the severity of the illness or injury, how long the work is going to take, and how committed the families are to doing the work outside of the office.
Because everyone's different. What other forms of therapy can be integrated with this, like occupational therapy or speech therapy? Can you use that in conjunction with this?
What is great about MNRI is our core specialists come from different backgrounds. There are some that are speech pathologists. There are some that are physical therapists, educators, psychologists. So we come with a collective body of work and approaches, and we try to utilize those together to maximize results. So yes, it can help with, if your child is doing speech therapy, to integrate some of these exercises as well to get to those goals a little bit faster.
All right, that's fantastic. So what advice would you give to parents who are considering MNRI therapy? What do they need to do?
Okay, well, first, do a little research.
Okay.
You want to find a provider who has done the training and really knows what they're doing. There are other programs out there. You know, you can spend $99 and get certified to be a reflex integration specialist. There's no work like MNRI I've searched that has done the research and required the extensive training as this. That's the first thing I would do. So find someone who's trained. Second, be committed to learn and do the work. We have a phrase we use often: simple is profound.
I like that.
This is not hard work, and parents can learn to do it. And if you're committed to doing it and practicing at home, you're going to see results faster. It's like training for a marathon.
Absolutely.
If you do it once a month, you're not going to do very well on race day.
You're not.
It takes commitment.
Right.
And then lastly, just be committed to the process.
Okay.
People expect results really fast, and sometimes we see it really fast.
Right.
But depending on what's going on in the body, you have to be committed to the process.